With all the different plans available with Medicare, you may be wondering what your best Medicare supplement, also known as Medigap plan options, are this year. Today, I will be covering the current federally standardized Medicare supplement options and which ones will be the best for you in 2022 and beyond. Hi, I'm Rick Teska, CEO and owner of Strive Medicare. Before we get into it, make sure to hit the like button and subscribe to our updates on our Medicare plans and changes. We are always trying to release helpful content to help our viewers make the best decisions when it comes to their Medicare plans. For this video, I really want to help you understand the plans that will give you the best bang for your buck. All right. So let's dive into the current Medicare supplement plans and which ones are the best. So just to refresh your memory on what a Medicare supplement plan is, Medicare supplement insurance fills the gaps between what original Medicare pays and what you must pay out of pocket for deductibles, co-insurance, and co-payments. Medicare supplement policies only pay for services that Medicare says are medically necessary, and payments are generally based on the Medicare approved charge. Medicare supplement policies are sold by private insurance companies, but Medicare supplement benefits are set by the federal government. Now that you remember exactly what a Medigap or Medicare supplement plan is, let's look at the chart on the screen to see the comparison of the 2022 Medigap plans and their corresponding benefits. There are 10 Medicare supplement insurance plans. Each plan is labeled with a letter of the alphabet and has a different combination of benefits. Plan F has a high deductible option. Plans K, L, M, and N have different cost-sharing components. Every company must offer Plan A. If they offer other plans, they must also offer Plan C or Plan F. All 10 Medicare supplement plans, A, B, C, D, F, G, K, L, M, and N, provide what are called basic benefits. These basic benefits, as outlined in the chart, cover hospitalization, hospice, medical expenses, and blood. Plans B, C, D, F, G, and N pay the entire Part A deductible. Plans K, L, and M pay a percentage of the Part A deductible, and there are different out-of-pocket limits that apply to plans K and L. Plan N requires a $20 copay for most office visits and $50 for emergency room visits. Plans C and F pay the Part B deductible and essentially offer 100% coverage with generally no out-of-pocket costs outside a monthly premium. Plans C, D, F, G, M, and N pay for skilled nursing facility care co-payments from the 21st day through the 100th day in a benefit period for skilled nursing expenses eligible under Medicare Part A. Plans K and L pay a portion of skilled nursing care costs until you meet the annual out-of-pocket limits. The plan will then pay 100%. Plans C, D, F, G, M, and N pay for 80% of emergency care charges while traveling outside of the United States. Plans F and G pay the Medicare Part B excess charges that Medicare doesn't pay, which are limited to 15% above the Medicare approved amount. The most popular Medicare supplement plans are Plans G and Plan N, and we'll get into that in a second. You may be asking, what about plans like Plan L, Plan K, or Plan M? Now, these plans may make sense to buy in certain states, but they are not as available and widely offered as some of the more popular plans. So looking at the two most popular plans, Medicare supplement plans G and N, each covers a set of federally standardized benefits. Medigap Plan G offers 100% coverage of the following expenses, including the Part A deductible, Part A and Part B co-insurances, and your first 3 pints of blood transfusion. It also covers the Part A hospice and skilled nursing facility co-insurances, 80% coverage of emergency overseas health care, and any excess charges that you might incur. Like Plan G, Medigap Plan N offers 100% coverage of the following expenses: the Part A deductible, Part A and Part B coinsurances, and your first 3 pints of blood transfusion. It also covers the Part A hospice and skilled nursing facility coinsurances. The Plan N covers the Part B coinsurance except for the copayment of up to $20 for some office visits and a $50 copay for emergency room visits that don't result in inpatient admission. Emergency care received overseas is also covered at 80%, and Plan N does not cover any excess charges that you may incur. If you're confused about Medicare Plan N versus Plan G and which one to buy, don't worry, you're not alone. The 2 plans offer similar benefits, and your doctoring situation will likely point you in the direction of the best plan choice for you. One of the most common questions we receive is which supplement plan is better, Medicare Plan G or Plan N. Not only are there differences in coverage between Plan G and Plan N, but the cost of these policies is also shown a tendency to vary as well, in some cases by a significant amount. Premiums for these plans will vary by the Medigap company that sells them. Plan G is usually more expensive than Plan N. The reason Plan G costs more is that it provides more coverage since you are not responsible for those additional 2 copayments. In our opinion, Plan G is the most valuable Medicare supplement plan available. It gives you the most coverage and doesn't typically save you a substantial amount compared to Plan N. If you are someone who doesn't visit the doctor often and are a fairly healthy person, Plan N might be a good choice for you if you're on a really tight budget. But keep in mind, if you only went to the doctor once a month with a $20 copayment, that's going to pretty much negate any savings and still leaves you exposed to the ER copayment and possible excess charges. This could end up costing you more in the long run. Even if you go to the doctor a few times a year, we typically see Plan G providing the best value. For $15 to $30 more on average monthly premiums, you don't have to worry about any unexpected out-of-pocket expenses other than the Part B deductible. For example, if you go to the emergency room a few times throughout the year, or if you need to visit your doctor's office for treatment regularly, your out-of-pocket costs with Plan N could easily add up and cost you more than if you had selected Plan G. Choosing a Medicare supplement plan is important, and finding the right plan to meet your needs may either be an easy decision or more complicated than you imagined it to be. The bottom line is that it all depends on your current personal health profile and what you anticipate your health status to look like in the near and distant future. You may have an elective surgery coming up that might increase the number of times you'll need to see a healthcare provider. Your finances may also be impacted. These are all things that should be taken into consideration in your final decision between Plan G and Plan N, or any other of the 8 Medicare supplement plans that may be available to you in your area. There is no right or wrong answer to choosing between Plan G and Plan N, or any other of the standardized plans. The right decision depends on your unique situation. If you feel you need help choosing a plan that is right for you, we have licensed professional advisors here to help. What we do is provide the list of the options, including companies, rates, and ratings for both Plans G and Plan N, so you can make an informed choice. For a free no-obligation consultation, call this number on the screen or sign up for a meeting by clicking on the link in the description and picking a time that's convenient for you.